We understand that these times remain challenging. CMI continues its mission to make it convenient for you to get premier outpatient care while deliberately making CMI the safe clinic for you and all those who are dear to you. Premier outpatient care is now available in the tip of your hands. With the same unhurried, meticulous attention, you can consult with CMI's broad range of specialists by phone, by video, or in person. For patients who prefer to see their doctor in the clinic, virtual patient screening for symptoms is mandatory prior confirmation of your appointment. We send online health declaration forms for you to fill out. Once your appointment is confirmed, you are all set to go to CMI. Since companions are not encouraged, patients are dropped off at the main entrance of Ori Central, where CMI is located. Kindly keep your mask on at all times. We want you to be safe in our clinic, right from the doorstep. Here are the clinic protocols we have implemented for your protection. Upon entering, your temperature will be checked by our care specialist. As we prepare your suite, you will be seated at our lobby while observing social distancing with other patients. You may get your snacks at our refreshments area, one patient at a time. Disposable cups for hot beverages have replaced reusable cups for the time being. Hand sanitizers and rubbing alcohol are also placed in key areas of the clinic for your easy access. Our doctors, care specialists, and staff are all wearing DOH-compliant personal protective equipment to ensure providing you with premier patient experiences. Your consultation is done in the privacy of a clean and spacious consultation suite. We also ensure to follow new normal processes for your physical therapy sessions and diagnostic procedures. Aside from our dentist and full personal protective equipment, we also use aerosol suction machines and acrylic covers during your dental procedures. If your doctor prescribed medicines, you may veer away from crowded drugstores as we have our pharmacy in the clinic for your convenience. We want you to be safe while in our clinic, even as we stay safe ourselves. All CMI staff undergo regular COVID-19 surveillance using Roche antibody screening. Lastly, CMI was conceptualized and built with your utmost safety in mind. CMI is on negative pressure airflow, and our high-efficiency particulate absorbing HEPA filters are built in. Since day one, we have been using UVC lamps to sanitize the clinic in between patients and after clinic hours. Also, our housekeeping staff regularly cleans and disinfects the consult rooms after each patient's use. In CMI, we are committed to provide the premier care you require and the safety you expect. Visit us at CMI for your outpatient medical needs.
Good afternoon, everyone, and we hope you are well. Centro Medical International, or CMI, is a premier outpatient clinic located in the heart of BGC. With over 150 specialists and subspecialists on our roster, CMI continues to be here for your medical needs, such as specialist consultations, by phone, video, or in person, diagnostic procedures, and preventive treatments, such as vaccinations and checkups. No crowds, no queues, no hassle. CMI is the safe clinic for you and all those who are dear to you. CMI is open Mondays to Saturdays, 8 a.m. to 4 p.m. Visit our website www.cmi.care or visit our Facebook page facebook.com/cmi.care for the latest updates.
Thank you everyone for joining us for today's webinar, Your COVID-19 Pregnancy, What Every Expectant Mother Should Know. Our speaker for today is Dr. Joanna Lozada-Pascual, CMI's Obstetrics and Gynecology, Maternal and Fetal Medicine, Perinatology Specialist. For today's webinar, though it is always exciting and wonderful to have life growing inside you, it is a bit challenging nowadays due to COVID-19. CMI wants to make sure that we provide medical support in any way we can, supporting each other as we continue with our mission of providing premier patient experience. In today's webinar, our speaker will share with us what every expectant mother should know from prenatal care to breastfeed and lactation during this pandemic. Before we proceed, just a few reminders. We have muted everyone's microphones and turned off your videos for the duration of this webinar. For any questions, please type them in the chat box, which can be found at the right side of your screen. We will group similar questions and have our speakers cover as much ground as we can. If you have not already done so, it will be great if you can include your full name to help us identify you properly for your questions and for other matters where we might need to reach you. And now, it is my pleasure to introduce our speaker, Dr. Joanna Lozada-Pascual. Dr. Joanna Lozada-Pascual is a practicing obstetrics and gynecology specialist in CMI. She finished her medical degree at the University of the Philippines, Manila, where she was awarded an outstanding medical intern in obstetrics and gynecology. She underwent residency training in obstetrics and gynecology and clinical fellowship training in maternal and fetal medicine at the UPPGH. She was a former faculty member in San Beda College of Medicine and section head of maternal and fetal medicine in one of the busiest hospitals in the country. She is a fellow of the Philippine Obstetrical and Gynecological Society and Philippine Society of Maternal and Fetal Medicine. She is also a diplomate of the Philippine Obstetrical and Gynecological Society and has accomplished various researches on obstetrics and gynecology. Friends, ladies, and gentlemen, let us welcome Dr. Joanna Pascual.
Good afternoon, everyone. And thank you very much for that very kind introduction. And thank you, CMI, for giving me this opportunity to talk about a very timely topic now that we are almost a year into the lockdown, or the community quarantine as our government leaders call it. As mentioned, aside from being a general obstetrician and gynecologist, I am also a maternal and fetal medicine specialist. I specialize in high-risk pregnancies, pregnancies complicated by medical and surgical conditions, and pregnancies with fetuses that need closer supervision and care. Most of my patients are indeed high risk and require a bit more spoiling, I would say. I am also a lactation specialist, lactation consultant, and as a matter of fact, one advocacy of mine is breastfeeding. Can you see my slides?
Yes, Doctora.
Right. So the COVID-19 pandemic in the Philippines has quickly reshaped our social landscape, greatly affecting our social interactions, including people's intimate lives. Today, I will talk to you about your COVID-19 pregnancy, what every expectant mother should know. So for those of you who may be an expectant mother now, or maybe know someone who is, listen up, and I hope you learn a lot from our webinar today. This would be the flow of our discussion this afternoon. A brief touch up on the COVID-19 Philippine situation, where we are now, and then we go to the diagnosis of pregnancy, when and how. Then a brief review of what we know about pregnancy and COVID-19 based on the data that we have collected so far. And then we go through the 4 important areas of prenatal care, delivery, postpartum care, and breastfeeding and lactation. So where are we now in this COVID-19 pandemic? These are the latest graphic information from our COVID-19 Worldometer as of the end of January 2021. We have exceeded the 500,000 mark with the total number of cases. We still see 1,000 to 1,500 new cases daily, but thankfully a declining trend in the number of active cases because of the very good numbers of recovered cases. Although we are still seeing a rising death toll due to COVID-19. So what do this mean? I think that COVID-19 is still up and about, and in the medical community, honestly, we still cannot see it ending real soon. And so that is why we are still clearly under continued general community quarantine. Stay home is still the best policy. Many of us are on a work from home arrangement, and so many couples find themselves having more time for intimacy. What happens then? Oh, there goes the missed period. And then there's the positive pregnancy test. A good number of pregnancies during this pandemic are unplanned, but thankfully not unwanted. Couples readily take on the responsibility, but admittedly with butterflies in their stomach and with knees shaking. So what do we know now about pregnancy and COVID-19? First, pregnant women or recently pregnant women who are with advanced maternal age, overweight, and have pre-existing medical conditions such as hypertension and diabetes seem to have an increased risk of developing severe COVID-19. And when pregnant women develop severe disease, they also seem to be more often requiring care in intensive care units than non-pregnant women of reproductive age. Additionally, pregnant people with COVID-19 might be at an increased risk for other adverse obstetric outcomes, such as preterm birth or delivery earlier than 37 weeks. Second, pregnant women should take the same precautions to avoid COVID-19 infection like other people. You can help protect yourself by proper and frequent hand washing, or washing your hands frequently for at least 20 seconds using warm water and soap or with an alcohol-based hand rub. Wearing a non-valve multi-layer cloth face covering or non-medical disposable mask where it is not possible to keep sufficient physical distance between yourself and others. Avoid touching face, eyes, nose, and mouth. Following aggressive social distancing. What is aggressive social distancing? It is not going out unless you absolutely have to, and staying 6 feet apart from others and avoiding crowded spaces. Next is practicing respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Third, several studies worldwide have shown that as high as 50 to 75% of pregnant women who tested positive for COVID-19 did not manifest any symptoms. This doesn't necessarily mean COVID-19 positive pregnant women are less likely to show symptoms. It does, however, offer us clues about the prevalence of people who have unknowingly been infected with the virus and aren't showing symptoms but are still contagious. So you should be very careful. These are all combined information from the US Centers for Disease Control, or CDC, and the World Health Organization. So going back, oh, wait, so here's an infographic. Here's an infographic circulated by the CDC containing essentially all the same information that I have just mentioned. This has been quite a popular infographic. I'm sure at one point in time you must have encountered this. All right, so going back, so we have already made a diagnosis of pregnancy. What is the next important step to do? That is to seek prenatal care. Okay. The first step in providing maternal and newborn services during the COVID-19 pandemic is to determine pregnancy status. Once a woman discovers she is pregnant, she must contact her OBGYN and shall be scheduled for a documentation of the pregnancy. This is usually done via first trimester scanning or transvaginal scan to find out if the pregnancy is intrauterine and if it is viable, meaning there is good fetal cardiac activity. So again, call your doctor. Okay. You see here that's the doctor is reached through teleconsultation. The second step in providing maternal services is to encourage the pregnant woman to continue antenatal care visits. Let COVID-19, let it not stop you from getting your recommended or your very important prenatal care from your doctor. All right. In discussing this, I would like to discuss with you the new care model that we have now in obstetric practice. As I go through it, I will be touching on the role of telemedicine, virtual visits, and in-person visits, obstetric ultrasound and its use, and the recommendations for vaccinations in pregnancy. You can see here a photo of an OBGYN doing a teleconsultation with her pregnant patient, and they are discussing about the result of an ultrasound. All right. So prior to the COVID-19 pandemic, the use of telemedicine was very minimal in obstetric practice worldwide. Despite its growth in other healthcare areas, few healthcare facilities or providers were set up to provide OB telemedicine services. However, in the short span of 4 to 6 weeks into the lockdown, this has changed dramatically. We have seen hospitals and OB practices quickly responding with broad adoption of telemedicine as a means to protect pregnant patients from viral exposure. OB clinical protocols were drafted and adjusted for telemedicine to play a vital role. As you can see here, many healthcare services can be delivered via telemedicine during and even after pregnancy. In green ink are the services delivered during pregnancy: virtual prenatal care visits, consultation with specialists like your maternal and fetal medicine specialist or your genetic counselors, and at-home monitoring of the weight, blood pressure, fetal heart rate, blood sugar, and the like. For the at-home monitoring, we ask our patients to equip themselves with a weighing scale, a blood pressure monitor, a fetal Doppler, and a glucometer when necessary. In blue ink are the services delivered after pregnancy. There's virtual postpartum visits and lactation support. And in yellow ink are the services delivered both during and after pregnancy. And these are your online communication with your doctor or with your healthcare providers, and even mental health care. So you see, much of what you really need from your OBGYN can be delivered via telemedicine. I myself had to make this paradigm shift in my obstetric practice. Like I said, my high-risk patients require a bit more pampering. And when the lockdown was imposed in mid-March, they literally started missing me. And so thankfully, CMI was the first of all my clinics that reconnected me to my patients via telemedicine. So as early as April of 2020, barely only a month after the lockdown, I was already having regular teleconsultations with my patients in CMI, thanks to CMI. Telemedicine can be used in many settings, such as hospitals, outpatient clinics, doctor's offices, and inpatients' individual homes. Virtual visits can occur with the following requirements: a camera, a microphone, and either a cellular or an internet connection between the parties. So your typical OB telemedicine visits can occur in four ways. Right. First, there's the live. It's a two-way synchronous visit wherein the patient and the doctor connect at the same time while being on two different locations. This is our usual teleconsultation. Next is store and forward, wherein data or image, like for example, an ultrasound, is captured in one place and time and received and evaluated by the doctor at a different time or at a different location. This is sometimes used for the diagnosis of a fetal anomaly in an area where there is no maternal and fetal medicine specialist available. So the MFM will confirm the diagnosis of the fetal anomaly using this type of telemedicine visit. Then third, there's the hybrid visit. The hybrid visit blends live audiovisual call with a concurrent store and forward data or image transmission. For example, a maternal and fetal medicine specialist is consulted while the patient has ongoing ultrasound in another location. Like in this photo, this is a well-known MFM specialist in the US, I think in the state of Arkansas. And he is being consulted in real time by the patient who is currently having her ultrasound in another state. And then fourth is a fourth way is the remote patient monitoring, wherein the patient is instructed to monitor at home and to report to the doctor on the next live call. So what does the patient monitor? I think I mentioned it in the previous slide already. The patient will monitor her blood pressure, her blood sugar, and other symptoms that need to be watched out for. So here in the upper left photo is an example of a live consultation, which is the two-way synchronous. So this is the doctor and that's the patient. In the lower left photo, this is a photo showing an example of a store and forward teleconsult, wherein the two healthcare providers are conferring and are talking about the results of some lab tests done for a patient as they plan for the management of that same patient. And here on the right photo, this is this photo shows me doing a hybrid type of teleconsultation. So I was on a Zoom conference meeting with this sonologist who was doing an ultrasound on a patient who was admitted. So the patient was in the hospital, and well, we wanted to confirm the findings related to her medical problem. This patient is hypertensive and diabetic and has been admitted for preterm labor. So you see here a shift from the old care model. So this is the old, a shift to the new care model. Okay, the old care model has 12 to 14 in-person visits. And one of those would include the ultrasound there. While the new care model, as you will notice, would only have 6 in-person visits. So that's usually about 4 to 6. And then there you see you have 6 virtual visits. Studies have been made with regards to the compliance of the patients, and surprisingly, patients have better compliance with this care model. So more patients are absent during their prenatal visits in the old care model, but they're more religious in attending or in availing their antenatal care visit with this care model. The pandemic has forced us obstetricians to rethink an outdated system and redesign prenatal care to meet patients' needs. So what we want is we want our pregnant patients to continue receiving prenatal care without increasing their risk of exposure to the virus. Now let us talk about obstetric ultrasound. So in the new care model, there needs to be only at least one, up to 3 essential scans. And the most ideal would, and with regards to the timing, are the following. So in the first trimester, which is done between 8 to 14 weeks, we do here a transvaginal scan, which would be necessary to, as I mentioned, to document an intrauterine and viable pregnancy. Or this would be the initial documentation of a live embryo. The second trimester, the recommendation here is to do a fetal anomaly scanning, and the timing would be from 20 to 26 weeks. And in the fetal anomaly scan, we check on the fetal anatomy, the gender, the fetal weight, and well-being. In this scan, we check if there are any physical or structural abnormalities in the fetus. And in the third trimester, which is done approximately between 35 to 38 weeks, we do biophysical scoring to check for fetal well-being, amniotic fluid, presentation, all of this in preparation for the impending delivery of the baby. If the three scans are not feasible, the minimum recommended scan would be this, the fetal anomaly scanning. So here in the upper photo, that's me pre-pandemic. So this was taken pre-pandemic, so we weren't wearing masks yet and face shields. This is me doing a fetal anomaly scan. Okay. So nowadays, we do our obstetric ultrasound this way. The minimum recommendation is for us, the sonologist, to wear a level 3 personal protective equipment, wherein you have a mask, a face shield, and a disposable gown. And with a note of limiting our scanning time to just about 15 to 20 minutes per patient. Now we go on to the topic on vaccinations recommended in pregnancy. Did you know that a baby gets disease immunity or protection from mommy during pregnancy? Yes, this is an absolute truth. This immunity can protect baby from some diseases during the first few months of life. Although we already know that immunity may decrease over time. So a pregnant woman should get vaccinated against whooping cough and flu during each pregnancy to protect herself and her baby, with immunity lasting up to the first few months of life. The two vaccines recommended for every pregnant woman are the flu vaccine, and in the new care model, this is recommended to be given on the first in-person visit. The other vaccine is the Tdap, or it's the vaccine against tetanus, diphtheria, and pertussis. Pertussis is the whooping cough. And this is ideally given once between 27 to 36 weeks. So this is a regular pregnant patient receiving her vaccine. This is a flu vaccine being given to her. So what about the COVID-19 vaccine? Right, so there's much talk already about the COVID-19 vaccine. It's almost within our means, within our reach. And so is it recommended for pregnant patients? The answer is only if the risks are too high. So what do we mean by that? You see, to date, there have been no studies made on pregnant patients receiving the COVID-19 vaccine. And so we don't have enough basis to make a definite recommendation to give it. However, we may have frontliners and healthcare workers who are pregnant and who may be at a much higher risk to contract the infection, such that they will likely benefit from the vaccine. And so, like this healthcare worker, she received the COVID-19 vaccine. This is in the US. Because we don't have it yet here. So, how do you stay healthy during your pregnancy? Here are 5 easy but very important tips. First, make sure that you get routine obstetric care. Keep all of your healthcare appointments during and after pregnancy. Consult your doctor for all recommended appointments. Let the new care model in obstetric care work for your best interests. Second, get recommended vaccines. Getting vaccinated can help protect you and your baby. Additionally, others living in your household should also get vaccinated to protect themselves and you. And third, ensure medicine supply. Keep at least a 30-day supply of prescription and non-prescription medicines. This is to reduce your trips to the pharmacy. Fourth, seek immediate consultation. Call your doctor if you have any concerns about your pregnancy or if you get sick and think that you may have COVID-19. Call also if you think you are experiencing depression during or after pregnancy. Fifth, call emergency room if needed. Do not delay getting emergency care because of COVID-19. Emergency departments have steps in place to protect you from getting COVID-19 if you need care. If someone else is driving, call while you are on the way. If you need to drive yourself to the emergency department, call before you start driving. We now go to the next step in providing maternal and newborn services during the COVID-19 pandemic. This is facility-based delivery. All pregnant women should be referred to a birthing facility as appropriate for delivery with a skilled healthcare worker, regardless of COVID-19 status. So these are the standards of care when we deal with the delivery already of the pregnant patient. First, we request for a nasopharyngeal RT-PCR swab test at 36 to 37 weeks. This is to determine the COVID status of the patient and to classify her accordingly so that she can be assigned to the properly designated area, that is whether she's a clean case or a COVID case. Right? And then we ask them to do strict home quarantine for 14 days after the RT-PCR is done. And while awaiting results, in order to maintain the validity of the test so that she can be classified accordingly. Classification as COVID or non-COVID case based on symptoms and on the RT-PCR test result when valid. Right? And then as to the route of delivery, obstetric indications are still followed when deciding whether to deliver vaginally or abdominally via C-section. The diagnosis of COVID-19 infection is not at all an indication for abdominal delivery. With regards to rooming in of the neonate, the COVID-19 status of the mother is ascertained. If the mother is COVID positive but would still like to breastfeed, necessary precautions have to be made, and the mother has to be advised, as well as the rest of the family members. And then there's always the intent to discharge the mother and the child early, especially if they are non-COVID. All efforts exerted towards sending them home within 12 to 24 hours from delivery if normal, and within 24 to 48 hours if C-section. Now we talk about postpartum care. Since we send the mother home early, we provide the family with a postnatal care checklist at home. We give them specific instructions when to call the doctor, and the doctor should be easily available through teleconsultation. Then we require the mother to seek teleconsultation after just a week. Subsequent follow-ups will depend then on the needs of the patient and her baby. Like for me, since I am a lactation consultant too, I tell them that they can consult anytime if they want to have guided breastfeeding sessions with their newborn. And sometimes, especially for first-time moms, they would seek teleconsultation up to once or twice a week because, well, that's good for me. I like that because I can see that they're really determined to become successful breastfeeders. I would like to think that most of my patients have become successful breastfeeders and that they are always proud to admit that whenever I see them. Okay, so here we have to ensure that breastfeeding is continued. That's part of the postpartum care. Additionally, I included here also contraceptive advice. This is also the time that you can consult your doctor too regarding methods of contraception that would be best for you. Next, this is our last topic, breastfeeding and lactation. Current evidence suggests that breast milk is not likely to spread the virus to babies. So you, along with your family and healthcare providers, should decide whether and how to start or continue breastfeeding. Breast milk provides protection against many illnesses and is the best source of nutrition for the babies. So definitely the benefits outweigh the risks. So if you have COVID and choose to breastfeed, wash your hands before breastfeeding, wear a mask while breastfeeding, and whenever you are within 6 feet of your baby. But if you choose to express your milk, you also need to exercise safety precautions with milk handling and storage. Um, I also usually teach my patients this, no? Breast massage and back massage. They are both very good, very effective in increasing milk supply and to increase the likelihood of a sustained breastfeeding career for the mother. Of course, again, there is the vital role of teleconsultation in providing support and counseling for breastfeeding and lactation. So these are the massages that I was talking about. This is the breast massage and the back massage. I teach them this. And here's a mom who decided to breastfeed despite her COVID status. So that's why she's wearing a mask. Here's a mom who decided naman to just express her milk. So there she is. She's ready with her electric breast pump. Lastly, my dears, please ensure your own social, emotional, and mental health. Surround yourself with happy, cheerful thoughts. Interact with people who are supportive and encouraging. Again, you may seek teleconsultation with specialists, whether it is still your OBGYN or a psychologist or a counselor. Book an appointment and address your concerns. Tailoring obstetric care to meet patients' medical and support needs is foremost in our minds so that we can improve care value and patient experience. Thank you.
Thank you so much, Dr. Joanna Lozada, for that enlightening talk. I'm just going to start my video. Hello, Dr. Lozada. So we'll now open the floor for the question and answer part of our talk. So we have a few questions from the audience. The first one is let me see. So what are the usual lab tests or procedures that we should have throughout the pregnancy? Which of these tests would you consider non-negotiable, especially for high-risk pregnancies?
All right. So the basic prenatal laboratory tests would be a complete blood count, a blood typing with RH, your urinalysis, um, screening for hepatitis B infection, and for syphilis. So that's a
Mhm.
RPR and the VDRL. And well, it's routine already to request for fasting blood sugar
Mhm.
for all patients because the reason here is that being Filipinos or of Hispanic um, race, we are at an increased risk to develop gestational diabetes mellitus. So we have already asked that routinely. So that's for our normal non-high risk patients. So for high risk patients, it's actually it depends on the reason for her being a high risk patient. If she's high risk because she's prone
Mhm.
to preterm labor, then we would have to request for cervical assessment using a transvaginal scan.
Mhm.
If she's high risk for hypertension, then we would have to request for some blood chemistry tests,
Mhm.
cholesterol. Um, if she's high risk for the gestational diabetes, even if it's only on the first trimester, we can already request also for a
Mhm.
75-gram OGTT and do away with the FPS.
Mhm.
Then we also request for the HbA1c. All right, so which are non-negotiable. I would answer it this way. So
Mhm.
with the new care model, we have recommended is that because you see all these tests can be done in
Mhm.
one sitting
Mhm.
for as long as you are prepared well for it because there's fasting, there's the advice of a non-fatty meal, depends on the laboratory test that will be requested. But if you are well advised and prepared from a previous teleconsultation,
Mhm.
then when you do schedule it, you can do all of this in one time, and you can do it at the same time as your transvaginal,
Yeah.
your first scan. So
Mhm.
I think that
Yes.
it's best that if you do all of it.
Yeah, I think basically the point, Doctora, is that you still need your blood test. I think,
Yeah.
right? That's what you're
Yeah.
saying, and hindi talaga it's still an important tool, but because of the new care model that hospitals and CMI, of course, as well as following, you can schedule it so that you only leave your house a limited number of times or you only go to the clinic once. Like, for example, here in CMI, you can do your blood tests in the morning and then see your doctor and have your scan all done in the same day. So I think there are things that clinical care settings are doing so that the risk is minimized for patients and also for physicians.
That's true.
So there are a lot of questions, Doctor, about what it will really look like when they're about to have their baby na. Like there are a few questions here on when I go to have my delivery, are companions allowed now? And I think for a lot of women, I guess the support that happens during delivery is very important. So I think I suppose different hospitals will have different policies, but maybe in general, is there a general policy from the society that you can enlighten us about?
Right. Okay. So I already mentioned in my slide that
Mm-mm.
uh, an RT-PCR test is routinely asked already
Mm-mm.
of our pregnant patients at 36 to 37 weeks, and we ask them to do a 14-day strict quarantine, waiting for their labor. So
Mm.
hopefully they get in labor. They deliver within that 2-week period.
Yes.
Most hospitals would require only one designated companion, only
Mhm.
one, so no visitors,
Okay.
even if they get to be classified as a clean case, so for everyone's
Mhm.
safety, no social visits anymore in the hospital. It's not like before when there's a baby in the family, the whole family comes and brings along balloons and everything, and gifts for the baby. It doesn't happen anymore during this time. So we designate one companion. And most of the hospitals that I know or that I am affiliated with request for a swab test too for that designated companion.
Oh,
So if the
okay.
companion will also be required to adhere to that 14-day quarantine along with the patient.
Mm. Okay, so mukhang they have to do a lot of preparing pala in terms of swab tests. Sana hindi po
Yes.
delayed yung delivery, then that means they'll need another swab. Is that correct?
Yes. So you see, if we request it at 36 weeks, that the validity will be until 38
Mm.
weeks. But we wait for labor until about 39, 40 weeks, right? So
Mm.
if they don't deliver within the first 2-week period, they have to repeat the swab because they're still
Okay.
waiting for the for the for the labor to come.
Okay. So, mothers, that's something to plan for na pag-ipunan. Baka ilan yung kailangan na swab so that both you and your husband will be able to make it to the delivery room. However, Doctora, if hindi updated yung swab, is that something that's done on admission? I mean, of course, it's a
Right.
hospital.
So these are for emergency cases, no? For example,
Mhm.
you didn't know you would deliver, you would experience signs of labor, and you haven't done the swab test yet for some
Mhm.
reason, for some valid reason. Yes, we do it upon admission, but we will have to classify her as a possible COVID case.
Okay.
Not necessarily putting her together with the COVID confirmed cases, because
Yeah.
there's a like a transition phase where we put our asymptomatic pregnant patients awaiting the results of their swab. So they stay there. They cannot be assigned or assigned a room in the clean case area
Mhm.
because we don't have the swab yet. Well, the swab results come out within 24 hours or less if they're inpatients. Medyo mabilis naman if they're admitted already because it has to
Mhm.
be facilitated talaga.
Mhm. How about for CS, Doctora? Are husbands allowed to be present right now in the operating room, or is that something unfortunately that we've had to, do away with due to COVID-19?
Yes. Unfortunately, the husbands are not anymore allowed to
Mhm.
enter the operating room, or because I asked the husbands to be really part of the birthing process, no? So I usually, before pre-pandemic, I would call the husband when the baby is out already, and then I would really show them the baby. So as
Mhm.
in parang fresh from the oven, parang ganon. So, but right now, we don't do that anymore because,
Mhm.
uh, well, ultrasound nga lang, level 3 PPE tayo eh. So,
Oh, that's
it's a
true.
clean case since a lot of pregnant patients are asymptomatic positive, and
Mhm.
sometimes there are some cases that they have the swab test to be negative, but then they become positive in a few days. So with those cases, the minimum also for deliveries is to be on a level 3 PPE. Uh,
Mhm.
then we put on the hospital gown on top of it. So, um, sorry, dear daddies,
Oh no. Okay.
you're just going to have to wait in the room. Anyway, we
Mhm.
still practice early rooming in. So if
Mhm.
the baby is a well baby, you will see the baby right away. It's just not as fresh as before.
Okay. So we have some vaccine related questions, Doctora. So one question is, how soon after getting the vaccine is it safe to get pregnant? So maybe this is a mother who's not yet pregnant and is deciding if they should get the vaccine uh, when it's available.
Right. Okay. So the answer to that is the same as what I said, no? Because there are actually no studies on
Mm-hmm.
pregnant patients receiving the vaccine. Well, those who have received it already, were they're the first ones to be observed, no, what happens to them. But if we will base our recommendations, no, we cannot say how soon after you can get pregnant, but since we give it to pregnant healthcare workers,
Mm-hmm.
we can safely assume that it won't matter if you get pregnant the following day. It's, it won't be a problem because
Yes.
we don't have enough data to tell
Mm-hmm.
you not to do that.
Mm-hmm. So I suppose if your risk is high enough, like because of work or any, exposure, I think that, and you don't have anything stopping you from getting the vaccine right now, the best recommendation is just get vaccinated as soon as
Yes,
possible.
yes.
Okay. How about for when mothers deliver, right? Because if they have to wait until they've delivered to get the vaccine, but they want to breastfeed. Will breastfeeding be a problem with receiving the vaccine? Because we have a question on, is it safe for breastfeeding mothers to get the COVID vaccine?
Right. So it's well, breastfeeding should not stop them from getting the vaccine, and in the same manner, getting the vaccine should not stop them from breastfeeding. Um,
Okay,
because
so
of the lack of data. So we just assume that they're just like the general population
mhm,
receiving the protection from the vaccine that the vaccine can afford at this time.
mhm. Okay, so I think that's unfortunately all the time that we have for today, though we do still have some questions. So we'll try to answer the questions. We can send them to Dr. Lozada-Pascual, and we can send you the answers of the questions that she's able to answer. And we'll just wrap up first by asking Dr. Lozada if you have any last words to sum up our discussion for today, any parting words for our audience.
Three
Thank
parting
you.
words. Okay. Well, pregnancy is indeed a special time full of excitement. uh. I always see it as a very pleasant life experience. But for expectant mothers facing the outbreak of the coronavirus infection, I think the fear and the anxiety of it all and the uncertainty may cloud this
Mhm.
otherwise happy time. So I hope that I was able to shed some light through this gray realm, and that our attendees today who may be pregnant already or are planning to be pregnant will be reassured that we in the field of obstetrics, and especially in the field of maternal and fetal medicine, are doing our best to meet our patients' needs to deliver still quality care and better patient experience. So again, I thank you for this opportunity, and if
Mhm.
you have further queries, you may reach me through our CMI teleconsult services.
Okay, so thank you, Doctora. So before we finally end, I just want to ask you a personal question. I had my fearless forecast. Sorry, ay wala nang video si Doctora. If you think that uh, the pandemic has forever changed the way that people will have prenatal care, do you think it's going to change from now on?
I think so, yes. Uh, because right now we are seeing the benefits of the new care model, and we are actually affording better obstetric care for our patients, and our patients are happy.
Mm-hmm.
Surprisingly, we all had to adjust to this digital age and everything. But um, there's very good reception of the
Mm-hmm.
care model, and yes, I think it's here to stay.
Mhm. Okay, so thank you again, Dr. Lozada-Pascual. So this ends our session, everyone. Thank you for attending our first webinar for the year 2021. If you would like to reach out to Dr. Lozada-Pascual, we'll be flashing CMI's contact details. So CMI is open Mondays to Saturdays, 8 a.m. to 4 p.m. Visit our website, www.cmi.care, or our Facebook page, facebook.com/cmi.care for the latest updates. So thank you again, everyone. Goodbye and stay safe.